As soon as the clock strikes 9 p.m. in Nairobi, the movement of people on the streets comes to a halt. The strict dusk to dawn curfew is meant to stop the spread of COVID-19, but it also threatens the lives of women in labor.
Before, patients would use their own means, that means their own cars, they'd get a neighbor to drop them, they'd get a taxi, a boda. But then with the curfew that runs from 9 to 4 a.m. right now, it becomes difficult because they cannot use their own cars, they cannot get a boda outside their house to take them to the facility. Their neighbors are not able to take them, so it becomes really challenging for mothers to get to facilities.
Wheels for Life, a free ambulance service for women in labor, has become a lifesaver for hundreds of expectant mothers. It's an initiative by a group of doctors at Kenyatta National Hospital. They started it after noticing a sharp rise in the number of women dying in childbirth since the curfew began.
Maternity-related cases has gone higher. On average, we're doing 2 calls per night. So far, we've done 88 calls, maternity-related cases.
One of those calls came from Christine Wanjiru's husband. His wife's contractions started 3 hours after curfew began.
When the water broke, she told me. I was very confused. I did not know where to take. I did not know how we are going to make it to the hospital. I did not know how much time we have. But I called 1196. I spoke to a doctor. Then the doctor sent me, the doctor suggested that they send an ambulance.
Kenya had no public ambulance service until Wheels for Life started. It's run as a public-private partnership with corporate donors covering the costs. They promise women will be wheeled to safety long after the pandemic is over. Adesewa Josh, TRT World.